I'm here in Kericho County with the Global Fund team. We've come for a visit here. We're working very closely with the National Treasury and the Ministry of Health at the national level and county levels here, as well as KEMSA, in support of a mass distribution campaign for LLINs across Kenya. The Global Fund has been very engaged with Kenya and other countries on these types of distributions for malaria control. And I think we're on the right path to supporting Kenya in fighting malaria. The nets are a very important aspect in vector control, and we hope that they reach all the intended households and that people are able to use them until the next ones are able to arrive. So very happy to be here. We've done a number of visits in Kisumu and around Kisumu and Nandi and Kericho counties, but the campaign is around the country in 24 counties. We're supporting together with our colleagues at PMI. And we've done a couple of mass campaigns together. This is the fourth one in Kenya, and I think for this one there were really a large number of stakeholders involved. I mentioned some of them before. We have the different levels of the government, national, county, sub-county, down to the community level. We have the community health promoters who are engaging in the distribution, village elders. We have our colleagues at KEMSA. We're also, the funds are going through the Treasury, of course. So there's been so many stakeholders involved in this process, but there's been really good coordination, a lot of very, I think, positive political leadership. So the coordination has worked really well. There's a national steering committee that has been a good platform for decision making and troubleshooting any questions that come up. So despite there being so many parties, it's worked very smoothly, I think. All the different parties have gotten the information they need to be able to work well together. So it's been a really good collaboration across a lot of stakeholders in Kenya, and we're really happy to be part of it. And a second highlight, which is one of the things we wanted to visit during our trip here, is the Digimall platform that was developed here. It was a local development, and it's a online application that all different parts of the system have been able to use to track where the nets are, to place the net orders, to see exactly how many nets are where and how many have been distributed. So it's provided so much transparency to ensure that the nets are going to where they should be, and also to be able to maximize the process. And so if there are extra nets left over in one area, they can be moved to another county that still needs them, which is what happened here in Nandi and Kericho counties. So the Digimall platform is very exciting, and I think Kenya is demonstrating itself as a leader in this area and this type of work, and we hope that this can be done in other countries as well. KEMSA has always been involved in the mass net campaigns, but this time KEMSA was tasked with doing the distribution all the way to the last mile, we call it, which is the distribution post where the nets are given out to the beneficiaries. So KEMSA has played a very integral role in all of this. From the moment the nets are received in Kenya to the regional stores, national stores, regional stores, and down to the county level. So it's been a big operation, as I mentioned, with a lot of coordination across a lot of different parties, and so we're very happy to see it working well. Well, I think in this campaign there was a lot that was done differently, and so in the first counties everyone involved was still learning a bit about the best way to do this, and we've seen that throughout the campaign the process has really gotten strengthened quite a bit. So maybe if there were bumps in the beginning, these things have all been sorted out as we've gone. So for example, around the registration, that is very dependent on having the right information in the communities, and I know the malaria program is very focused on this, having social and behavioral change communication, risk communication, messaging out in the community so that they're aware, so that they know to come, so that they can benefit from this activity.